Hi, Dr. Yass here. I'm doing this video because I just finished a session with a woman, and it is so overwhelmingly apparent to me that there is such a complete lack of understanding as to what is creating symptoms. And she made it extremely clear to me that she was under the impression that these varying symptoms she was having were from nerves. That all her symptoms were relating to nerves, and therefore the ability to be coerced into the idea of getting an MRI from the spine to check out her neurological symptom was validated by the doctor saying that her symptoms were nerve related, and the symptoms she was having were in the gluteal region, the hip region, near the ankle, and that just didn't matter. All that happened was she went to the doctor to try to explain where her symptoms were, and she said there's a burning sensation, a radiating sensation. I had it at my hip and gluteal region and groin, and now it's at my ankle, and so it's radiating. And so I said to her, first of all, let's start with the radiating symptom. You use the word radiating, but I don't even think you understand what that implies. Radiating implies that the cause of the symptom, the tissue in distress eliciting the symptom, is in a place that's not where the symptom is being experienced. That is different than if you say, I had original symptoms in the hip and the gluteal region, and now I'm beginning to feel a symptom at the ankle, so there might be a connection between the two. But to say that the symptom at the ankle is radiating from something at the hip region is baseless. Baseless. You can't say that. You can't just make that up. There would have to be some sort of testing done to establish whether the symptoms at the ankle are being created by a tissue at the symptom at the ankle, which may be the result of some altered muscular deficit at the hip, making muscles at the ankle have to work harder, versus saying it's literally being referred. Literally, the tissue in distress is at the hip or gluteal region, and it's referring it. That is a baseless statement. But she used the magical word radiating because it's culturally accepted due to the fact that everything is nerve-based, because the MRI for 40 years now is telling you that, which is bullshit and complete lie. But it's become part of the culture, the word radiating. So she says it's radiating, and the neurologist says, okay, well, you said radiating, so I'll say it's nerve. You got to be very careful when you use words like radiating. There's a difference between saying radiating and being related to. You use the word radiating, and I'm telling you now, you just hit the magic button for the neurology world to say nerve, when in fact it could simply be related to, which still means it can be muscular. Number two, she said she's having a burning sensation in the hip region. Burning does not mean nerve. It does not mean nerve. Muscles, when straining, produce lactic acid. A byproduct of a pure muscular contraction is lactic acid. If a muscle is strained and becomes inefficient in its ability to perform an activity, it is going to produce a massive level of lactic acid. Acid would feel like burning. So stop thinking that burning equals nerve. It doesn't, especially if I touch the area where you're feeling the burning and I'm touching a muscle, or you feel the burning coming as a result of an activity. Clearly that's a muscle. So stop using the word referred. Stop using the word burning, thinking that that's nerve. Neither of those represents nerve. Then we talked about the idea that she just generally thought that pain comes from nerves, because nerves conduct pain. And I explained to her that most tissues, bone does not have it, fibrocartilage does not have it, but most tissues have pain receptors in the connective tissue that surrounds the cells of that tissue. I'll say it again. Cells make up tissues. Cells are surrounded by connective tissue, and connective tissue have pain receptors in them to acknowledge when the cells of the tissue are breaking down and trying to create a signal indicating that an intervention is required to resolve the distress of that cell and tissue. The pain receptor is ignited in the connective tissue, and the pain receptor sends a signal back to the brain via a cell to create conscious awareness of distress of that tissue. But it is the tissue that's in distress. It is igniting the pain signal, not the nerve that takes the signal back to the brain. There's nothing wrong with the nerve. I gave her an example. If you have a kidney stone and it's eliciting pain, do you think there's a nerve in your kidney? If we opened up your kidney, you're going to find a nerve? If you get palpitations of the heart, you're telling me you think if I open your heart, there's a nerve in there? It's the connective tissue surrounding the tissue, the cells of that tissue, that are igniting pain receptors that then send signals back to the brain via a nerve. It is the cells of the tissue. It is the tissue that is eliciting the symptom. Nerves, as a general rule, do not elicit symptoms. Certainly, if you had a metabolic or systemic disease, certainly that can cause a breakdown of nerves, but as a general rule, pain is elicited by pain receptors that sit in connective tissue that surround cells of tissues, which are ignited when the cells elicit the symptom of pain due to distress of the tissue. Okay? So if you're having pain from a muscle, it ain't a nerve. It's the muscle cells breaking down, eliciting the pain receptors that are in the connective tissue that surrounds the muscle. Stop thinking pain, burning, tingling, any of these things automatically mean nerve. You don't know that, and I assure you those who are treating you don't know that. But culturally, everybody on the planet has now assumed it, because the culture has been created by the advent of the use for 40 years of the MRI and the fact that you go to a neurologist to establish what your cause is. If you come out with a neurological diagnosis, you can't possibly tell me that that's confusing, that somehow you thought you were going to get a diagnosis other than a neurological diagnosis from a neurologist. Please tell me that's not confusing. You go to a neurologist because you have been coerced into thinking words like radiating pain, burning pain, referred pain. That's just stuff that you've gotten built into your head because you've heard it enough. But the physical evidence doesn't show it at all, and that's what I showed this woman. I showed her that all her symptoms were muscular based. All those false premises that the nerve was creating the pain, that the symptom she was experiencing near the ankle was referred somehow, meaning that it was from a tissue or a nerve somewhere other than where she was experiencing, or the burning in the hip region was from a nerve, it was actually a muscle. We got to clarify this stuff. You got to get this and start understanding this, or you are walking dead. You are fodder for the medical system. This lady made it clear that if by luck she hadn't Googled me and found me, she would still be looking to get this MRI, still looking to find a structural variation, especially neurological, still heading down the path towards that failed surgery, which will lead to unending pain and altered sensation and altered function. Get the Yass method, the only method that actually determines the cause of pain through the presentation of symptoms. It is not culturally biased. I don't buy into all this nonsense about everything is neurological simply because an MRI was developed 40 years ago. That's the very thing that's impeding you from getting the proper diagnosis. If you want to learn more, if this is wrapping through your brain and saying, wow, you know what, it kind of makes sense, and you want to find out more from me, just email me at my email address, drmitch@mitchellyass.com, drmitch at mitchellyass.com, drmitch. I do Skype sessions, Zoom sessions, just like with this lady. We can establish cause, resolve cause. If you're in the group of 98 to 99% of people that have a muscular cause, with the proper exercise, this could be ended, and you could have your life back and return to normal function. Okay, if you like the video, if this makes sense, give it a thumbs up. If you like my YouTube channel and what I'm putting out, please subscribe so that you can get notifications when I'm putting these videos out. I'm trying to put them out one every day or every other day. I'm getting the information out as much as I can. It's all applicable to you and trying to help you understand what's causing your symptoms and how to resolve it, because it's coming from the very people that I'm interacting with in trying to resolve their symptoms. I specifically just told this lady, now that we finished, now I got to get this video out because people have to be warned. I learn through those I treat. And she made it damn clear that she was completely confused as to how to determine whether her pain was muscular, and basically recognized she was in fact coerced into thinking this has to be nerve, because that's all everything is. All right? Let's get smart. Let's get educated. Let's make our own decisions about how to address pain with a proper diagnosis and proper treatment. That's what this is all about for me. For now, Dr. Mitchell Yass wishing you a pain-free, fully functional life. Bye-bye for now.